Hi, everyone. Thanks for joining. We're going to take a little time to set up here and probably give folks another couple of minutes to join. So bear with us over the next couple of minutes. All right, we're going to wait just a couple minutes longer to just let some more people come in. Thanks for joining, for everyone who's here. Really appreciate it. This is actually the first time we've had a webinar where we've invited folks who have supported us over the years by purchasing our guide to health plans to be part of one of these sessions. I often give these webinar talks with various agencies that subscribe to our guide to health plans for federal employees. And one of my colleagues for a couple of years has been recommending, hey, we really should be, doing this for the folks who are purchasing our guides. So we finally have started doing it. It's long overdue. We really value everyone's participation in this project, all of your past support. And many of you, whether this is the first time that you've heard of Checkbook or our Guide to Health Plans for Federal Employees, whether someone invited you to this webinar, whether you've been buying this guide for as long as it's been available, or maybe you've been buying it for decades, just really want to thank you for your support. We'll be able to continue to do this without you. I have a little bit of help tonight. One of my colleagues is with me. Her name is Natasha. She's going to be managing kind of the chat and the Q&A function. Natasha, do you want to hop in and say hello?
Yep. Hi, everyone. So yeah, as Kevin said, I will just be looking out for any questions, and we will try our absolute best to get all your questions answered at the end.
All right. Thanks, Natasha. So why don't we start? I think, open season, every year open season is really important, and there's always changes that impact federal employees and annuitants. This year is no different. And so every year there's homework. That's one of the things that we always say. Every year you have homework to do, whether you're motivated to switch plans or maybe you're happy with your existing plan. One thing that I always advise federal employees is that the plan that you have this year is not going to be the plan that you have next year. There's things that change. Most likely the premium has changed. There's benefits that could change. All of these changes could impact whether your current plan is still the best plan for you. So even if you think that you're not going to be switching plans, you still have homework to see how is your health plan changing. So let me tell you a little bit about myself. I'm Kevin Moss. I'm one of the editors of Checkbook's Guide to Health Plans for Federal Employees. I've worked for Consumers Checkbook for, believe it or not, it'll be 11 days from now. It will be 25 years that I've worked for Consumers Checkbook. I've been a part of this project for all 25 years. And I'm going to tell you a little bit, some housekeeping, just to get this out of the way. So one thing is that after this webinar, there will be a recording to the webinar, and you will receive an email. It may take a few minutes, maybe even up to an hour, because the video has to process. But once that video is available, there will be a link, and you will be sent an email with a link to this webinar presentation. Second is, I always get asked, what about your slides? And Natasha in the chat will put a sticky note or a pen with a link for you to download these slides as a PDF. So if you want this content, go there. Also know that you'll have a recording that you can watch on demand. So let me share with you our agenda for tonight. I'm going to give a short background on Consumers Checkbook, our organization, and the Guide to Health Plans. Then I'll share with you insights from the guide, what the guide can show you. Some of these are evergreen insights that are true every year, but we'll also share some new things that are happening next year in 2024. One of the biggest questions I always get from active federal employees: high deductible health plans, HSAs, consumer-driven health plans, HRAs. So we will spend some time talking about those options. Flexible spending accounts, we definitely want to highlight those. Then we'll talk about dental coverage available from FEHB dental and vision plans. If you have questions, there is a Q&A in this Microsoft Teams at the top. You should see Q&A. Go ahead, submit your question in there. At the end, as Natasha said, we're going to try to get through as many of those questions as we can. And if you're not comfortable asking a question in this format, feel free to send us an email. Natasha and I answer a lot of emails. I think personally last year I answered over 1,000 emails from federal employees and annuitants. So if you have a question about something, we don't get to it tonight, our email address, guide2healthplans@checkbook.org. Once again, thanks for being here, and let's get it going. Okay, so Consumers Checkbook, who are we? We're a nonprofit 501c3 organization. We were founded in 1974 in the Washington, D.C. area. The thing that a lot of people know us from is the Consumers Checkbook magazine. This is a publication and website that's available in 7 local markets around the country, including Washington, D.C., Boston, Chicago, Philadelphia, Seattle, the Twin Cities, and San Francisco. It has quality and price ratings on local services and healthcare professionals. So anything from home contractors, auto services, healthcare providers, pet care, and more. Big thing, independent, unbiased, no advertising in any of our publications or websites. There's no outside money. You can trust that the information that we provide to you is unbiased, our best answers to complex consumer problems. We do a lot of quality reviews and surveys of our members and other local consumers to help develop those quality ratings. And then we do undercover price research conducted by Checkbook staff to report on price. You can boil it all down. What we're really trying to do is provide consumers with the information they need to make smarter decisions, especially when those decisions are really complex and there's lots of choice involved. And when we think about FEHB, this is one of those choices that's really complex and there's a lot that's going on. When we really think about picking a health insurance plan, it's quite hard, even for health economists, to pick a health insurance plan because it forces you kind of to do 2 things at the same time. You have to weigh both your predicted healthcare expenses with things that you can't predict. None of us know next year if there's going to be an accident, whether we might be diagnosed with a new condition. And so we want to make sure that, we're with a plan that covers the things that we can predict, but we also want to make sure that we're protected against the things that we can't predict. And there's other additional options that make choosing a plan difficult. In FEHB, you have 4 different plan types. You have HMOs, PPOs, consumer-driven health plans, or CDHPs, and high deductible health plans, HDHPs. They all operate a little bit different, and how they work and how much you have to pay up front versus how much you have to pay when you actually use a healthcare service, it does differ amongst all those plans. There's a lot of different choices there. Then next year in the DC area, there are 37 different FEHB plans that are open enrollment available to all employees. That's a lot of choice choice generally is a good thing. This is a competitive marketplace, and the idea is that if you have lots of health plans in the marketplace, that they will compete in order to enroll members, and this will improve quality and push down costs. That's the idea. I think that we see that in the FEHB system, but it's a lot to go through, and no one person could do a very long review on all 37 different choices available to them if they live in the DC area. We also see a wide range of costs. If we continue to look in the DC area and we look at self and family enrollment next year, there's a wide gap between the lowest premium plan, which is $3,400, and the highest premium plan at $22,000. So it's a very complex decision. There's different plan types. There's a lot of different plans, about 3 dozen, wide range of costs. So what do we do? Well, we publish a guide, and it's the Guide to Health Plans for Federal Employees. And this year is actually the 45th year that we've published our Guide to Health Plans for Federal Employees. The first edition came out in 1979, and this year is the 45th edition. And the key idea behind the Guide to Health Plans for Federal Employees is we need to consider the 2 buckets of costs really that people are going to face in a given year. And one is the for sure expense of premium, right? So you enroll in a health plan, you're going to pay that full premium whether you go to the doctor once or however many times. That's a for sure expense. But everyone who's in a plan is also going to have some level of out-of-pocket usage. And what we really need to do is combine both of those into what we call a yearly cost estimate, which combines the premium plus the estimate of out-of-pocket healthcare expenses. And wouldn't it be great if we could actually somewhat predict what typical healthcare expenses would be in a given year? And we do this by asking information. When you use our plan comparison tool or when you use our print guide, we ask information based on the things that we know will influence healthcare spending. So we know family size, the age of the primary insured, and your expected healthcare usage does tell us something about what your healthcare utilization will be in a given year. We can then model that utilization over a range of healthcare costs, and then we can apply that utilization to each plan that you're eligible for. This produces the yearly cost estimate, which is a benchmark ranking of the plans from least to most expensive. When you use our plan comparison tool or you use our print guide, we're always going to show you the plans ranked in order of yearly cost estimate from least expensive to most expensive. That benchmark ranking will show you where there is value and which plans will offer you the best deal in an upcoming plan year. And one of the best things that it does is it really helps you to eliminate a lot of health plans that are just going to be too expensive and not be the right fit for you. So instead of having to wade through those 37 health plans, when you use our plan comparison tool, hopefully that helps you narrow it down to maybe 4 or 5 plans. If you're using our online plan comparison tool, you can then compare up to 4 plans side by side. When I use this tool myself, I would pick the 4 lowest cost health plans side by side, and then you will be able to scroll and see the various benefits that these plans offer. So you'll be able to find things like the deductible. You'll be able to see even more information about, well, what if I have low costs? Or what if I have really high costs? Or what's my absolute catastrophic maximum if I'm in one of these plans? See what differences there are and maybe find benefits that are of significance for you. Maybe it's maternity benefits and finding a plan that has low cost or free maternity coverage. Maybe it's finding a plan that does the best job of covering acupuncture. Once you're able to narrow the plan list down, then you're able to fine tune it based on the things that matter to you. Could be quality score. All of that data is available to you when you use the plan comparison tool. But the starting point is always to make sure that what we think is the most important factor in choosing a plan is that yearly cost estimate, because there is so much money on the line. And that gets us to our first insight. Switching plans could save you quite a bit of money next year, depending upon which plan you have now and which plan you might choose. In the DC area, for a family of four, the yearly cost estimates have a range of about $5,000 all the way up to almost $17,000. If you currently have Blue Cross Standard, you could keep a PPO plan and move down to GHA Elevate. If you did so, you'd save almost $4,000 next year. And most of those savings are for sure savings because of the much lower premium in GEH Elevate compared to Blue Cross Standard. If you're willing to consider a consumer-driven health plan, you could save even more and save about $4,600. So make sure that you're looking at your existing plan. Make sure that you're looking at where that plan is ranked in our benchmark rankings on yearly cost estimate. Take a look and see if there's some plans that could save you quite a bit of money. And depending upon the plan that you're in now, you could save thousands of dollars by switching to a lower cost plan. All right. The way that FEHB works is that oftentimes one insurance carrier will have multiple plan options available to you. And I think it's always important to make sure, are you in the right plan within that carrier? I highlight Blue Cross because 2/3 of all federal employees have one of these three plans, one of the Blue Cross plans. And there are big price differences between these three options. And I think it's always important to consider, are you in the right Blue Cross plan? Blue Cross Standard is the most expensive national PPO plan in terms of premium. It also has probably the best benefits of any FEHB plan, but there may be benefits in that plan that you're not using, and you could be overpaying perhaps. So with Blue Cross Standard, it's the only one of those two plans that provides out-of-network coverage. It's also the only one of those two plans that has mail order prescription drug coverage prior to retiring and being on Medicare. It's also the only plan that has skilled nursing care. And it's also the only one of these three plans that has a new $25,000 infertility coverage benefit for assisted reproductive technologies, which includes IVF. If you're not using any of those four services, then maybe Blue Cross Standard may not be the right plan for you. And maybe you could go down to something like Blue Cross Basic, which doesn't have a deductible. So that's immediately better. You're going to be paying a little bit more out of pocket, but not much more for a primary care visit copay and to fill a generic drug prescription. But the key thing is that just switching from Blue Cross Standard to Blue Cross Basic could save you it does save you $2,800 next year if you have self and family enrollment. So make sure you're looking at all the plan options. Blue Cross isn't the only insurance carrier that has multiple plan options. GEHA works the same way. NALC, Aetna has lots of options. United, depending upon where you are, Kaiser. So make sure you're looking at all of the plan choices and optimizing the right plan choice. If you're happy with the carrier, happy with the service that the carrier provides, happy with the provider network, that's the other point, is that the in-network providers are the same in Blue Cross Standard and Basic. So you'd be able to keep your existing providers, switch from Standard to Basic, save $2,800. All right. High premiums don't mean better coverage. In the DC area, MDIPA, which is offered by United Healthcare, has the highest premium, $22,000 a year for self and family enrollment. And if you look at this plan in our ratings in a low-cost year or an average year or a high healthcare expense year, it's always the most expensive option. Why? Well, paying a high premium is not going to diminish the out-of-pocket expense that you're going to face within that plan. They still have the typical cost shares that you would see when you're at a particular healthcare provider. So whether that be a copay or a coinsurance for a service, paying that high premium doesn't wipe out your out-of-pocket costs. the plan benefit structure is not more generous than because you paid that higher premium. And the result is that that for sure expense of the very high premium keeps that plan as the most expensive option. So finding the best plan for you and your family at the lowest cost, it requires you to balance both the upfront expense of the premium plus the estimate of out-of-pocket costs your family's going to face. So you need to find basically a happy medium between both, which is what the yearly cost estimate ranking does for you when you use our guide in our book. All right, two-person families. So this could be a married couple, or it could be a single parent and a child. You have an option in terms of how you enroll. You can either enroll as self plus one or self and family. Now, 3/4 of the time, self plus one is the least expensive way to enroll, but not always. So next year, there are 48 FEHB plans where self and family is actually lower. And so you're going to want to find out, if you're a two-person family, which way in my health plan that I want to enroll in is least expensive. And there's some serious money on the line here. Kaiser High in DC, the difference is about, I don't know, like $128 or so between self plus one and self and family. So if you choose the wrong enrollment type or you pick the right one, it could either save you $1,500 a year or cost you an additional $1,500 a year. And guess what? You get the same health plan either way that you enroll. So you just want to enroll in the least costly option. And there's the best way to find out this is in our guide to health plans. We will tell you if self plus one is cheaper. If you're using our website, there's a plan flexibility tab. There's a column that says self plus one is cheaper, and then it's a yes no column. Look to see if self plus one is cheaper there. Or the other thing that you can do is if you have the official FEHB plan brochure, which if you're using our plan comparison tool, if you click on the plan name, you will quickly find a link that will open up the plan brochure. And if you go to the very last page, it's a premium table that will show you self plus one, self and family for each plan that's in that plan brochure. It will show you the government share and it will show you the enrollee share. You looked at the enrollee share and just find the one that's least expensive. All right, wellness benefits. Continue to see FEHB plans offering wellness benefits to their plan members. These wellness benefits are found in section 5H of the official plan brochure, and sometimes you can actually find them in the section that immediately follows that, which is often labeled non-FEHB benefits section. We've added some of the most important ones on our plan comparison tool online. You can only see them in side-by-side comparison, or if you click on a plan name, that takes you to what we call the plan detail page. And if you scroll to the bottom, you will see some of these wellness benefits. So what type of wellness benefits are there? Well, a lot of health plans will actually pay you to do things that you should be doing. So one is, Kaiser Prosper in DC offers each plan member $375 if they have a total health assessment, current biometric screenings, and are vaccinated against COVID. And then many plans will either offer free or discounted gym reimbursements. Some plans have partnerships with ClassPass and other online and gym sharing memberships. There are tobacco cessation programs. Plus, you can often find discounts on dental, vision, hearing aids, and LASIK. So there can be a lot of hidden features in your plan that if you're not looking for them and you may be missing them. Oftentimes the plans on their own marketing materials and on the plan websites will talk about these. So that's another place to go to find out what wellness benefits are available. These are often free to you, but you have to take advantage of them in order to benefit from them. All right, what's new for open season in 2024? Quite a bit. And I think the biggest change is expanded fertility benefits. So earlier this year, OPM, which they always do in the spring, they have a carrier letter that they put out where they establish the goals of the next plan year. And in that, they mandated that all FEHB plans must provide certain fertility benefits starting in plan year 2024. So the coverage that must be provided by every FEHB plan: artificial insemination procedures, those three that you see there on the screen, the fertility drugs associated with those artificial insemination procedures, and IVF-related drugs for up to 3 cycles of IVF. This is a step in the right direction, but understand there's still quite a bit of expense that's not going to be covered even with this expansion of fertility benefits. One IVF cycle can range anywhere from $15,000 to $30,000, and fertility drugs are only 35% of that cost. The other thing to know is that the plans that have added this, sometimes the co-insurance is up to 50% of the expense in some plans. So the coverage and what you're going to have to pay out of pocket does vary from plan to plan. I've also seen some plans that have said that these services and what you pay for these services will not count to towards the out-of-pocket maximum. So having large expenses in these areas are not going to count towards catastrophic. Now, that's not universal. Not all plans have done that, but some plans have. So if you need fertility benefits, you have to very closely look at the plan brochures, see how these are in I think section 5A under reproductive care. That's where you're going to find a larger discussion about these benefits. Most of these do require pre-authorization or prior approval. So you also are going to want to contact the plan to make sure you understand the process to get approved. There is one plan that went above and beyond the OPM mandate, and that is Blue Cross Standard. They have added up to $25,000 a year for assisted reproductive technologies, which does include IVF. You must meet the plan's definition of infertility, and prior approval is required. The artificial insemination procedures and fertility drugs are not subject to that $25,000 annual maximum. So that $25,000 maximum is really going to the procedure itself. But keep in mind that you're still going to have to pay the deductible and Blue Cross Standard and 15% of the plan allowance when you're using preferred providers. And also keep in mind that Blue Cross Standard has the highest premium of any national PPO plan. So yes, you're getting coverage. Yes, this is a big benefit increase in Blue Cross Standard, but it does come at a price with a higher premium. One final thing to say about infertility coverage is that there is going to be a lot of out-of-pocket costs. You should definitely be using a flexible spending account. I know that the maximum contribution to the flexible spending account is probably in most cases not enough to cover what your true out-of-pocket expenses will be, but you should at least take the maximum amount on that flexible spending account and save an additional 1/3 out of what you pay from the flexible spending account. All right, we're going to go through some general FEHB open season advice. So if you haven't heard already, premiums are up again next year. The average enrollee increase is a little bit lower than last year, so it's going from 8.7% in 2023 down to 7.7% in 2024. When we look at both of those years combined, though, this year and next year, this is one of the highest 2-year periods of premium increases that we've seen recently in the FEHB. And we only have to go back 2 years to see that premiums only increased 3.8%. It may not be that comforting to know that OPM and FEHB are not any different than what's happening in the private arena. Kaiser Family Foundation a couple weeks ago put out their employer benefits survey where they said private employer health insurance is going up 7%. So this is something that's impacting health insurance everywhere in the country. We're still in a high inflationary state, and health insurance and healthcare is not exempt from that. understand that the premium increase is not uniform. Just because the average increase for enrollee share was 7.7%, it doesn't mean that every plan increased at 7.7%. In fact, 31 plans next year, the premium actually went down. 8 plans, the premium stayed the same. 68 plans, the premium increased, but below the 7.7% rate. And 47 plans are above that 7.7%. On the extremes, we saw one Texas plan premium decrease 54%. It's Baylor Scott and White Standard, which is available, I think, in Central Texas. And then we saw one Georgia plan's premium increase 22%. That's Kaiser High in the Atlanta area. Those increases for just cell phone only mean, saving $1,000 in the Texas plan example, but paying an additional $1,000 in the Georgia plan example. So these premium increases really do add up quite quickly to higher costs. Since we know 2/3 of federal employees have a Blue Cross plan, we talk a little bit about how Blue Cross plans have moved. Blue Cross Standard had a 6.5% increase, Basic 10.3% increase, and FEP Blue Focus only 2%. So keep in mind, again, this discussion about Blue Cross, which plan is right for me. Understand that if you're with Blue Cross Standard, there's possibly there's definitely some savings if you switch to Basic or FEP Blue Focus, but you may be getting the benefits you need out of Standard that you can't find in Basic and FEP Blue Focus. But make sure that you're asking yourself, am I actually using those benefits from Blue Cross Standard to justify paying such a high premium? All right. This is the last, I think, FEHB open season slide, and then we're going to go into high deductible health plans. So one thing that you always have to check, are there new plans that are newly available that I haven't seen before? And what about plans that have gone away? And let's first talk about what's going away. The big news is that this year we have 271 health plans. Next year, only 156, but that's almost entirely because Humana and all of their plans have left FEHB. They had many plans in Arizona, in Illinois, Texas, Florida, large metro areas where they had many plan options in different metro areas around those states, which contributed to a high number of plans. Humana leaving is almost single-handedly the reason why that plan number has dropped. But there are some other plans that have also left. NALC Value was a national plan that's no longer available for 2024. And there was a few HMO plans that have also left. Indiana University in the Bloomington, Indiana area, and then Alt Care, which had 2 plans in Ohio. Those have also left. There's not a lot to talk about in terms of new plans. Centara Health, which previously just offered plans in Newport News, has a new plan in Northern Virginia. So if you live in Northern Virginia, Centara Health is an option that you haven't seen before. Take a look at that. And then Compass Rose has added a standard plan. They had a high plan, now they have a standard plan, and they've also included the Department of Veteran Affairs as a qualifying agency for enrollment. So if you're a VA employee or you're a VA retiree, you now have access to Compass Rose, so make sure you're considering that. One other thing that can change year over year is the service area of a plan. And Kaiser plans in Colorado have both added and subtracted counties that are eligible for Kaiser plans. So that's also something that can change, where the same plan's available, but the service area can be drawn differently year over year. So make sure that you're also considering that. Benefit changes. This is where Section 2 of the health plan brochure is absolute must. You must do this. Even if you think that you don't want to switch health plans, you have to go to Section 2 of the plan brochure of your existing plan, see how it's changing. Any important change will be listed there, and you may find things that may change whether or not you would want to still stay in a plan. We saw a United plan change their catastrophic limit from 3,000 to 6,000 self-only, and 6,000 to 12,000 from self+1 or self and family, a doubling in 1 year, the catastrophic out-of-pocket max. Now, that adds a lot of additional risk being in that plan compared to this year. That may change whether that plan is still the right plan for you. You also can find that certain plans have added additional benefits. All of the infertility benefits that we talked about earlier in section 2 you will find discussion of those added benefits. You also might find that Blue Cross plans have added family and marital counseling for the first time this year. Samba plans have added doula coverage. So make sure that you're looking at section 2 of the official plan brochure. It's one of the most important things that you can do this open season. Also consider provider directory changes. You can't assume that your doctors, which were in network this year, are still going to be in network next year. And you might find that your health plan switched provider networks, and that happened this year. That's going to happen next year. If you're in an APWU plan, your provider network was Cigna this year. Next year, it's going to be United. That may change whether your existing doctors are still going to be in network. So this is something that you need to take a look at every single year. And the final piece of advice here, prescription drugs, same advice. You need to see if any prescription drugs are still going to be on the drug formulary. You want to check, you want to avoid surprises. Unfortunately, there's not a friction-free way of doing this. You're going to have to go to the plan websites and look for their provider tools or their drug tools in order to put in your doctors or put in your prescription drugs to see, will they still be in network? Will they still be covered? On the prescription drug side, many of the plans have pricing tools where you'll be able to choose your drug, choose the dosage, choose the pharmacy, and they'll actually tell you the price of the drug. So this is all really important homework to do every open season, whether you're motivated to switch plans or whether you think that you're going to keep your same plan. All right, I'm going to take a small drink of water. There's been a lot of talking, and there's more to come. All right, high deductible health plans. We're going to spend a little time on high deductible health plans. Get a lot of questions about them, sometimes some confusion about them. I think that a lot of people maybe never have taken a close look at them. And I really think high deductible health plans are a way to save both for planned healthcare expenses or even unplanned healthcare expenses now, today, in the future. And I'm going to make a case to you that a high deductible health plan with an HSA is an alternate retirement vehicle. So let's see if I can pull that off. So high deductible health plans, the way they work, they encourage participants to be smart consumers of healthcare. They have high deductibles, which means traditional health insurance kicks in once the deductible has been met. So before the deductible, how it works is you'll have to pay the full allowed charge for that service before the deductible. Then once you meet the deductible, most of these plans have a co-insurance, something like 5% or 20% of the allowed charge. And by the way, I think this is the worst marketing name ever for a plan, high deductible health. I like much more a health savings account plan because that's what these are, but they're called high deductible health plans. So it might sound scary with these plans for all your healthcare expenses out of pocket before you hit the deductible to be paying the allowed charge. But keep in mind a few things about how these plans work. One, all preventative care is free before the deductible. So this is annual physicals, well child visits, and other preventative care services are free before the deductible. Understand that you're probably likely going to be enjoying some premium savings when you enroll in a high deductible health plan. Most of the high deductible plans have lower premiums than many of the popular PPO plans. And the high deductible health plans are going to take a portion of the premium and put it into the health savings account without you having to voluntarily contribute more money if you don't want to. And you can use that premium pass-through that goes into the health savings account to help pay for any healthcare expenses you face before the deductible. When we look at the high deductible health plans, and we only have one example here on the screen, but high deductible health plans have some of the lowest estimated yearly costs in low, average, or high healthcare expense years. All right, when we talk about high deductible health plans, we have to separate consumer-driven health plans or CDHPs away from high deductible health plans or HDHPs. So first, we're going to talk about consumer-driven health plans. And the thing that distinguishes both of these plans is which type of savings account you get. With the consumer-driven health plan, you get an HRA or a health reimbursement account. In that account, the health plan actually manages the account. On day one of the new plan year, you receive the entire amount of the HRA upon enrollment. How much you get ranges from the plan, varies by the plan, but it ranges anywhere from $900 to $1,200 for self-only enrollment and between $1,800 and $2,400 for self+1 and self and family enrollment. Importantly, you cannot contribute additional funds into an HRA. The amount you get is set on a given plan year, and you don't get any more money until the next plan year if you stay enrolled in that plan. You can't bring in any additional funds on your own. Unused funds do roll over to the following year. So there isn't a use or lose with a consumer-driven health plan or an HRA. But sometimes there is a ceiling. I've seen plans that said, your HRA can't accumulate above $10,000. So you're going to have to keep that in mind. Qualified medical expenses covered by the plan, they're automatically deducted from the HRA. So you don't get much choice. When let's say you have a sick visit to the doctor, they're always going to pull from the HRA first before asking you to pay out of pocket. You cannot make any non-medical distributions with funds in the HRA. You can only use it for qualified healthcare expenses. And this one is really important. There is no portability in a CDHP with an HRA. That means the plan owns the account. That means if you're in one of these plans and decide next year that you don't want to be in this plan and you have unused funds, when you switch plans, you will forfeit any of those unused funds that are in your HRA. So the plan owns the account, not you. In many ways, the high deductible health plans with an HSA have a lot more options and a lot of really kind of interesting, cool things that are going on in them. For one, you get a health savings account. And with this health savings account, you can contribute additional funds if you want. And next year, the amount that you can contribute is going up. So it's going up to $4,150 for self only and $8,300 for self+1 and self family enrollment. And that's the combination of both what the plan puts in the premium pass-through and what you put in voluntarily. The plan still is going to make their own contribution as a premium pass-through into the HSA, but that only happens on a month-to-month basis. So for example, if one of these plans said that you're going to get $1,200 into your HSA, you will get 12 $100 contributions into the HSA from the plan every month of the year. The HSA is going to be managed by a financial service company that the health plan does business with, and you will be able to decide how you want to invest those funds. And as aggressive or as conservative as you want to be, you'll be able to invest those funds. Any unused funds do roll over to the following year, and there is no cap on HSAs. They can go as high as you can dream. And we've heard from many federal employees that have $25,000, $30,000, even $50,000 into an HSA because they have been in the HSA for many years. They are receiving that plan contribution every year, and many of them, if their situation allows for it, have been able to make voluntary contributions. Non-medical distributions are allowed, but if you're under 65, you have to pay both normal taxes and a 20% income tax penalty. But here is where the HSA is really like an IRA. If you're over 65, you just have to pay normal tax obligations for any non-medical distributions. That really makes it like an IRA, but it's actually better than an IRA because you never lose the ability for withdrawal for a qualified healthcare expense from the HSA being tax-free. And so most of us are going to have higher healthcare costs when we age. This is a way that if you were able to have the HSA while you're working and you're able to build up a fund, you'll be able to pay for Medicare Part B premiums or even some long-term care out of the HSA. So we really advocate quite strongly for employees to consider this plan option as a way to both save for healthcare expenses today, healthcare expenses in the future, and it can actually be a stream of retirement income once you turn 65. All right. And you want to try to maximize the potential of the HSA. We call it the plan contribution preservation strategy. You want to maximize it because you want to try to preserve that plan contribution as much as you can so it can grow year over year along with future contributions. Any voluntary contributions you make go in tax-free, they grow tax-free, and if used for a qualified medical expense, they're going to leave tax-free. Here's two ways to help you preserve the HSA contribution. One, limited expense healthcare FSAs. When you have a high deductible plan with an HSA, cannot have the general healthcare FSA. IRS rule says that you cannot do that, but you can sign up for this limited expense healthcare FSA for qualified dental and vision expenses. And if you have this HSA with a high deductible, you should, because now you can use that limited expense FSA for dental and vision, not your HSA. Keep your HSA funds invested and growing. The other way to try to do this is don't pretend that you're getting a raise when you drop from a more expensive PPO plan into a high deductible health plan. It might be tempting to pocket that premium difference, but pretend you're still paying that higher premium, but take that difference and just contribute that, even just that small amount, into the HSA as a voluntary contribution. That can really add up over time, especially if it's invested. And understand that this program and these tax-advantaged savings accounts are only available while you're an active employee. Once you retire and you're on Medicare, you can no longer make voluntary contributions to an HSA, and a high deductible health plan, when you're an annuitant, will instead offer you the HRA and not an HSA. But also remember that the HSA you have while you're working is always yours. You own that account. You just won't receive new plan contributions once you're an annuitant. All right, final word on high deductible health plans. Many federal employees would save money switching to either a high deductible health plan or consumer driven, but they may not be the right plan for everyone. If you have significant prescription drug expenses, you're going to be paying the allowed charge for prescription drugs before reaching the deductible, and those out-of-pocket costs will be higher than many of the other PPO plans that have a fixed copay. It's going to erode some of that savings account value. So also, if you expect high healthcare usage, especially early in the year before that HSA can build up, this type of plan may not be the right plan for you. And any employee that may not be able to pay an unexpected health bill of $1,000 or more, understand that if you were unlucky and you had an accident at the beginning of the year, that plan's contribution into the HSA is only coming out 1 month at a time. You may be subject to that full deductible, at the beginning of the year. So if that would cause any type of financial duress, perhaps the high deductible health plan may not be the right plan for you. All right, we're doing good. We got 2 sections, and then we're going to open it up to questions. Flexible spending accounts, 100% of federal employees should have one, yet only 20% do. And this is one I'm always harping on, but really everyone hopefully on this webinar already has one. But if there's at least one person that doesn't, I hope that I can convince you that you should, because all of us are going to have some predictable out-of-pocket healthcare expenses. When we think about dental care, vision care, planned doctor visits, prescription copays, and over-the-counter pharmacy items, all of us are going to have some out-of-pocket healthcare expenses. And if you set up the FSA and you're going to be funding the FSA through payroll deductions before tax, that's going to save you about 30% on those expenses that you pay through the FSA, depending on your tax bracket. So if you have just a PPO or HMO, you can get the regular healthcare FSA. As we mentioned before, if you have the high deductible or consumer driven, you can get the limited FSA for dental and vision expenses. You do have to budget carefully. Don't take out the full $3,050 if you only expect $1,000 out-of-pocket expenses, because you can only roll over $610 in unused funds. So there is a use or lose principle with the FSA. So you're going to have to budget somewhat carefully, but you don't have to be exactly perfect, because you do have a little bit of wiggle room to move unused funds into the next plan year. New employees can enroll right away. Existing employees, you have to do it during open season, and you have to, every open season, make the election for the next plan year of still participating in the FSA. And again, the FSA is also a program that goes away once you retire and you're on an annuity. It's only for active employees, so take advantage of this now while you can. Go to FSAfeds.com. They manage the FSA program. One thing that I've heard about why people don't have the FSA is that, well, there's a lot of administration. I've got to keep track of receipts, and it's, the FSA is going to ask me to produce a receipt, and I've got to file a claim. I think if, and I remember, I'm old enough to remember where I actually had to fax in receipts, but these FSAs today, they work in a much smoother way. There is less friction. The federal program actually has paperless reimbursement, where some of this reimbursement is happening without you even having to produce a receipt. So if you haven't looked at it recently, take a look at it again. This is really a guaranteed way to save some money on healthcare expenses. So take advantage of it. All right, last section, it's dental. Then we're going to open up questions. And one thing that we do that's unique is we allow you to compare the dental care that the FEHB plans provide, both either as an official benefit or as an unofficial benefit that they may put in the non-FEHB benefits section, with the standalone FEHB dental or vision plans. So when you use our tool, and I'll show you this in a second, there's a dental, vision, and hearing tab, and you're able to sort columns based on the type of dental care user you think you're going to be next year. And that is step one in determining what you should do on dental care. And that's, which type of user am I? Am I a low user? And I'm mostly just using preventative services, which include exams, x-rays, and cleanings. Am I an average user where I'm starting to pick up some restorative services like fillings? Or am I a high dental user and I'm going to use some major restorative services like crowns? We show you how all these plan options rank based on each one of those usage scenarios. Next, what does my existing FEHB plan provide? Some plans, that answer will be nothing. Some plans, they actually may provide some preventative care within the FEHB plan. So before you decide to pay a separate premium for FEHB plan, make sure you know what dental coverage, if any, your existing FEHB plan provides, and then compare your options. So when you use our tool, apologize for the kind of not very high resolution screenshot here, but there's a dental and vision and hearing tab once you log in and you tell us who you are. And then there is a dental cost if your dental care usage were. And these are columns. Think of it like Excel. And if you click on the column header right by low, average, or high, that will resort the plans. And then you'll be able to see how all the plans operate. You can choose to just look at the standalone plans if you want, or you can add the FEHB plans. You do that by the plan type filter that's going to be on the left-hand side of the screen. And again, our Guide to Health Plans considers both the official dental benefits that are in the FEHB brochure, and then also any unofficial dental benefits the plans might offer. All right, this is actually the last slide. We made it. So there's a lot there that's going on in this chart, but I will tell you what it's trying to tell you. I'll try to tell you what it's showing you. And it's based on the usage estimates. And when you see things like HMO or consumer driven or PPO, that's an FEHB plan. And when you see Fed VIP, that's one of the standalone dental plans. And the first takeaway is that if you are a low cost user and you're mostly just using preventative services, you are much better off not enrolling in a Fed VIP plan, paying that extra premium. And by the way, you pay 100% of the Fed VIP premium. There is no government contribution for that premium. And our estimates show that this is only a handful, this is not exhaustive, but there are many plans where you will have lower costs based upon what some FEHB plans will cover versus the least costly standalone dental plan. When you start getting to restorative work, which is, fillings, you're now in the average usage, you will find, and this Dominion plan is only available in the DC area, but you're going to find a couple of Fed VIP plans that really are starting to become better values, but understand that there's still some FEHB plans that are still kind of hanging out there and are very close to the lowest cost Fed VIP plan. Once you have high usage, this is where the Fed VIP plans really shine. So if you need crowns, bridges, other really expensive dental work, then yes, you're going to get value out of that Fed VIP plan, and that will be the least costly option for you. I can't emphasize enough that you have to be comfortable with the dental provider network before making any decision on this. So if you were, for example, interested in the Kaiser coverage, that coverage is only available if you use a Kaiser provider. And if your dentist isn't a Kaiser provider, and you're not willing to switch, then that's not going to get you very far. So before considering an FEHB plan and what dental care it will provide, before enrolling in a Fed VIP plan and paying an extra premium, make sure you're carefully looking at the providers on the plan website to see if keeping your existing dentist matters to you, that your existing dentist is going to be in network. You'll always pay lower in network than going out of network. And you're really looking for the best value for your dollar here, and that's always going to be staying in network. One last thing on orthodontic care. The Fed VIP plans all cover orthodontic care. Last year, they took away the 12-month waiting period. That used to be a thing. On some plans, it's no longer a thing. But understand that almost all of these plans, I think all of them actually do, have a lifetime benefit maximum per person that they'll pay for orthodontic care. And oftentimes, I think you'll find that maximum is probably lower than what you are going to need for orthodontic care. So keep that in mind. Also keep in mind that dental care is the perfect flexible spending account expense to pay through a flexible spending account. It's somewhat predictable in terms of what costs you're going to face in a given year. So you can combine the strategy of using these estimates to guide you to the best plan choice and take the flexible spending account for any of your out-of-pocket dental expenses, and also it's there for any out-of-pocket healthcare expenses. All right, it's time for questions. Natasha, do we have any questions?
Yes, we have quite a few questions. So I tried to answer as many as I could in the comments, but let's see. So we have some Part D questions.
Okay.
Yeah.
Yeah, one thing to say about Part D, and then I'll let you ask the question, Natasha. I didn't cover any retiree issues in this particular webinar. We thought that we really wanted to offer kind of two different sessions. Tonight was really for the active federal employees. Actually, tomorrow, I think it's at 2:00. We're doing a retiree session, and we actually are sold out on seats on that webinar. I can only have 1,000 people join that webinar, but what's true is that that webinar recording will persist. So if you can't join that retiree webinar tomorrow, where we're going to go in depth on Medicare, Medicare Part B, Medicare Part D, Medicare Advantage, reach out to us at this email address, guide-to-health-plans@checkbook.org. We'll make sure that when that webinar wraps, that we'll send you the link where you can watch that webinar on demand. But I'm happy to answer a Part D question now.
Okay, awesome. So we have, let's see, we have a few of them. So we have one from Bill who he wants to know if we will be getting an annual notification to avoid a penalty for late sign up.
So how it's worked is there are 17 FEHB plans that have added Part D coverage, and these are prescription drug plans. OPM has allowed those FEHB plans to auto-enroll members. You will be auto-enrolled if you have either Medicare Part A or Medicare Parts A and B in all of those 17 plans, except for Blue Cross. And Blue Cross is one of the plan families where all three plans, Standard, Basic, and FEP Blue Focus, have a PDP plan or a Part D plan. With Blue Cross, you must have Medicare Parts A and B to be auto-enrolled. If you have Medicare Part A only, you will not be auto-enrolled in Blue Cross. The plans, if this impacts you, you should have already received a notification from the health plan that you have been auto-enrolled, and they give you a window up to 30 days for you to say that you don't want it. And we'll go into a lot of detail about why you may not want it. One of those reasons is this Part D IRMA, which is the income-related monthly adjustment amount, where if your income is above $103,000 for a single filer or $206,000 for a joint filer, you're subject to in IRMA, Part D IRMA. It's only about $13 a month. Well, it's not only, it is like, I think, $12.90 in the first tier of IRMA, the first income tier, but it does scale if your income is higher. And if you're not using prescription drug coverage right now, then you may decide, you know what, I don't need this right now. I want to disenroll. You'll have to contact the plan. The plan has a hotline, and it should be on any plan notification. It's also on the plan website for you to disenroll. I have heard some horror stories that people have been on hold for 30 to 40 minutes. So you keep that in mind, that if this is something that you don't want, I would advise taking care of this now versus waiting towards later during open season.
Okay, awesome. So we do have two more Part D questions. So someone wanted to know if they are retired military, can they sign up for Part D only?
Sure. Yeah, Part D only is definitely something that's out there. The FEHB Part D, it's kind of a package deal right now in FEHB, but there are standalone Part D plans. If you think that adding Part D is something that you need for enhanced prescription drug coverage, or maybe there's a prescription drug that you need that's not covered in your existing plan formulary, but you can find it on a Part D plan, that's something that's available to you. I recommend going to the Medicare Plan Finder. They have a really great website that allows you to put in the prescription drug or drugs that you're taking, the dosage, and seeing what the costs will be in each Part D plan. And so you'll be able to kind of get a good sense of what the for sure costs will be in premium plus your out-of-pocket costs to fill prescriptions.
Okay, great. So one more Part D question before we move on to some HSA, FSA questions, because we have a lot of those. But
Okay.
Charlie wanted to know if you have Part D, can you use manufacturer discount coupons to
All
reduce your
right.
out-of-pocket costs?
I should not be surprised that we have such a sharp audience. And you can't. So that's another reason that you may not want to keep Part D coverage if you're in one of those 17 plans. So if you're receiving pharmaceutical assistance in the way of discount cards, that if you have Medicare Part D, this disqualifies you from receiving that pharmaceutical discount support. What you're going to have to do is weigh what the value of that support is versus the potential benefit of the Part D plan, and make sure that you're taking a broad look at that, not just maybe the one prescription drug that you're getting a discount card for, but maybe what the full coverage will be in the Part D plan. I would also definitely make sure that for that prescription drug that you're getting support for, make sure you're going to that PDP formulary lookup, seeing what it will cost in the PDP plan, making sure that that pharmaceutical discount is worth more than the PDP. Also keep in mind that the Blue Cross plans, the Aetna plans, the MHBP plans, and I think Rural Carrier and Foreign Service all have a $2,000 out-of-pocket catastrophic limit on prescription drug costs next year. And if you have moderate to high prescription drug costs, having that PDP plan in one of those FEHB plans could save you potentially a lot of money, maybe more money than what that discount is worth to you. But it's still maybe true that that discount is very valuable to you, and that certainly is a reason perhaps for you to disenroll from the PDP so that you can keep that discount going into 2024.
Okay, cool. So on to the exciting HSA questions. So I believe someone in the chat wanted to know that if you're still working after 65, can you have an HSA?
Yeah, you can. So if you're still working after 65, you don't have to sign up for Medicare right away. And you don't want to sign up for Medicare right away because your FEHB plan will still be primary. When you do decide to retire, you will have a special enrollment window to enroll in Medicare. So while you're still working, you can contribute to the HSA past 65, and you'll also qualify for, and that's something that I didn't even talk about in this webinar, once you turn 55, you can contribute an additional $1,000 a year as a catch-up contribution. So your contribution limits are actually $1,000 higher than the regular contribution limits for someone that's under 55.
Okay, and Karen wanted to know, can you carry an HRA or an HSA into retirement with your FEHB plan?
Yep, the answer is yes to both. So with the HRA, understand that it's somewhat harder to get a higher balance in the HRA because the plan for any qualified healthcare expense you have is always going to try to pull out of that HRA first. And then some plans have a ceiling where you can't carry over more than $10,000. That's true in some plans. With the HSA though, the sky's the limit. If you started when you were 25 and you were very healthy, you didn't use very many healthcare services, and you stacked those plan contributions, and you were able to voluntarily contribute some more, and the stock market was your friend, and you realized some investment gains, again, we know people that have 25, 30, even 50,000 or more into a health savings account. So yes, you take that into retirement. And then once you turn 65, again, there's a lot of flexibility on how you want to use those funds. You could use them to pay for Part B premiums. You can always use them to pay for any out-of-pocket healthcare expenses. Those are always going to be tax-free. Even long-term care situations, you can use your HSA for. But you also have the ability, that penalty for non-medical withdrawals goes away once you turn 65, and you only have to pay normal taxes. So in that way, I really think it's kind of like an an IRA that's very flexible in terms of how you can use those funds.
Okay, and are overseas medical expenses allowed for an HSA?
I think yes. I think that's fine. Those are qualified healthcare expenses. I mean, I think the plan, they may need to see some receipts on that, but to make sure that they're qualified healthcare expenses. But I think overseas claims are fair game for the HSA.
Okay, awesome. And I did respond to this question in the chat, but I'm sure, Kevin, you have some additional insight. But Susan asked, can you have an FSA with an HSA plan?
You cannot, unless the FSA is the limited FSA for dental and vision. And I really advocate very strongly to do that. If you're going to be in a high deductible health plan with an HSA, the goal is really to try, if you can, realize it's always there if you need it. But if you can I keep that HSA invested and growing? And one way to sort of further that cause is for some really kind of predictable healthcare expenses, like, I go to the dentist twice a year for cleaning, and despite all my, good habits, I typically have a filling or two, to use the limited flexible spending account for dental and vision care. That takes the pressure off the HSA a little bit and keeps that invested and growing over time.
Okay, awesome. And Matt, he wanted to know if we have benchmark um, plans, disability plans for short term or long term on our tool for
No,
federal plans.
no, we don't have rankings of those plan options. This is strictly for, the FEHB health plans and the FEHB system.
Awesome. And Dana wanted to know, do some of the plans offer silver sneakers?
Uh, yes, but the plans that typically offer it are Medicare Advantage plans, actually. And tomorrow's session, we're going to talk about Medicare Advantage plans. The Medicare Advantage plans are, for most federal annuitants, going to be the least costly health plan option for them. And many Medicare Advantage plans do offer the Silver Sneakers program.
Okay, awesome. And then we have a question from someone in the chat. So, if we choose to use a spouse's non FEHB civilian health insurance, can I, as a federal employee, have a federal FSA?
Hmm. Man, always asking those questions that really hit. Um, if you are a federal employee, you're entitled to FEHB health insurance. And if you're a federal employee entitled to FEHB health insurance, I think that qualifies you for FSA feds. So I'm 98% confident that the answer is yes, but I can't give you 100% confidence on that one. My advice, go to FSA feds. They have a really robust FAQ. That particular question may be in their FAQ with an answer. If not, they have support where they could answer that question for you.
Okay, great. Okay, let's see. So, all right, we have one more FSA question. We have Carol who asked, can I have an FSA, not an HSA, as a retiree?
Cannot. Sorry, not my rules, but if you get paid through an annuity and you're no longer on payroll, FSAs are funded through payroll deductions, and so FSAs are only available for active federal employees.
Okay, awesome. And then um Barsum, I'm sorry if I mispronounced that, but they wanted to know, how do I know that the plan/carrier I elect has a good network?
Wow. Again, really, really congrats to this audience asking just really great questions. One thing that I didn't really want to get into because it's kind of inside baseball and kind of wonky, but this question opens up the door, is one of the things that we don't have in the FEHB system that we see in the Affordable Care Marketplace is that there are requirements of the Affordable Care Marketplace plans to provide machine readable data for both providers and prescription drugs. Having that data available in machine readable format allows for really good things for consumers, such as all plan provider directories where you can put in your doctor name and see which plans the doctor takes. It also allows you to put in a prescription drug to see how, does this plan cover my prescription drug or not. If we had machine readable data for providers, we would be able to do something called a network breadth score. this is something that we also, as Consumers Checkbook, we build plan comparison tools for various state marketplaces around the country. For example, we do it in the District of Columbia, we do it in Vermont, we do it in Maine, and in a place like Maine, they have this machine readable provider data, and we're able to give a score by plan of how adequate that network breadth is. Or another way to say it is, in this plan, what percentage of doctors that are out there are available to me to go see. Unfortunately, OPM has not made the same requirements of FEHB plans, and there is no uniform provider data in the FEHB system. And so we can't do network breadth. It is something that is very high on our list to want to do, because it is something that matters quite a bit in terms of the quality of care that you're going to receive in one of these plans, is access to adequate number of providers. And sometimes through these very complex negotiations, I remember a couple of years, either it was Care First or Blue Cross, that they were having a negotiation with Johns Hopkins, and there was a possibility that Johns Hopkins was going to leave one of those networks. And so knowing which networks are available to you, what providers are available to you, is really important. It's not something that we have now. We do have a lot of experience in our organization working with this data, and we hope that these reporting standards will come out from OPM so that we can start reporting that information to y'all.
Right. So going off of sort of expanding on the providers, JL wanted to know, since we always suggest that, of course, look in our tool for any providers that you want to see, but also you want to make sure. So we always suggest calling the doctor's office. And they were wondering, would it be more accurate to look at the plan provider directory or call the number on their card to ask if that doctor is in network? Because they've heard that a lot of times doctor offices will answer, yes, they take the insurance, but that is not the same as being in network or being a preferred provider.
Yeah, I would always go to the plan themselves. And even then, sometimes the plan information may not be as up to date as it needs to be, but it's the best shot that you've got. And I would go to the plan provider directory. I would search on the providers that I want to see the status of, and I want to confirm that those providers are still going to be in network. I would do that.
Okay, awesome. And it looks like we're also getting some more questions in the chat. And it looks like Jeremy has been doing an awesome job answering a lot of people's questions, but he is also wondering, can you continue to put money in an HSA if you are a federal retiree on FEHB and not on Medicare?
I think that answer is yes, but it's very complex IRS rules at that point. And have Jeremy send an email to guide-to-health-plans@checkbook.org, and I'll get back to him with the appropriate IRS documentation. It takes a little bit of time for me to find it, but I think the answer is yes if you're not on Medicare.
Okay, awesome. Let's see. So we have some specific questions. Dion is expecting a high usage year for their dental plan in the upcoming year. So they're wondering if they should be looking at the maximum dental benefit per person or how else they should choose a good dental plan, knowing that they'll have a high usage year.
Yeah, so what I would do is when you use our tool, go to the high dental usage year, sort the column on that high year, and then take those top 2 or 3 plans and then do a side-by-side comparison on those top 3 plans and see, one thing that you have to really make sure is that if keeping your dentist is really important, that may immediately narrow the field for you, where you're able to just not even consider a couple of plans because your dentist isn't going to be in those networks. So make sure you're definitely paying attention to that. And then once you know which plans will do the best job of treating a high cost year, then I will go into the details to see, okay, do one of these plans have a little bit higher, out of max protection for me, and have that narrow the choice down for you.
Okay, awesome. And Barbara would like to know, how do federal dental plans compare to comparative plans with Delta Dental? Are there any cost savings?
So Delta Dental is one of the carriers that offers a Fed VIP plan. I think they have two different options. So they're one of the carriers that offer this. Um, Maybe the person's asking, how do the Fed VIP plans compare to just regular dental plans that are out there? I think they're pretty good. I think they're pretty good. The premiums are very stable. I think the Fed VIP dental plan premiums only increase like about 2% year over year. So the premium costs are fairly stable. I think the coverage is pretty good, but understand that even with orthodontic coverage, you're still going to, it's in most of the plans, it's 50%. So you're still going to be paying 50%. So if the orthodontic bill is $2,500, you're going to be paying 50% of that. So yes, it is helping you pay for some of this, but you're still going to have high dental out-of-pocket costs if you're using something like orthodontics. So make sure that you are using the flexible spending account to help save at least additional 30% off those out-of-pocket dental costs.
Okay. And then someone wanted to know, with a PPO family plan, do you have an individual deductible that is smaller than the family deductible?
Um, So most of the deductibles, are combined together. So I mean, it's very common for let's just use easy numbers where there could be a PPO plan that for self-only coverage is 5,000 and the self and family deductible would be double that or $10,000. There are some plans that may have an individual deductible within self and family, but most of it is, you could have one person in the family that, oh, if we're talking about deductible, okay, we're not talking about maximum out of pocket. Sorry, I was giving you a maximum out of pocket example. Generally, it's a family deductible. So, like Blue Cross, for example, I think it's $700. And so once you have those $700 of expenses, then you've met the deductible, and that applies to everyone that's in the family and who's covered under the plan.
Okay, awesome. Um, I believe that covers most of the overarching questions people had.
Okay.
Um,
Well, this has been awesome. I want to leave just with a couple thoughts. One, if we didn't get to your question or this discussion made you think of a new question and we didn't get to it, this email address, guide-to-healthplans@checkbook.org, is a portal to both me and Natasha, where we will try to assist you to the best of our abilities during open season. We're always here for you. And really want to thank everyone again for supporting our plan comparison tool, supporting our guide. We're a nonprofit. We're really dedicated to helping people. Hopefully, this discussion helped you. If it did, give us some feedback of whether it did or not. If there's things that you wish our plan comparison tool had or guide had that it doesn't, we're always open to feedback on how to make it a better user experience, more useful for you. So thank you. Good luck. Open seasons opens up Monday, November 13th, and you have till December 11th, and you have a major federal holiday in between that. So do your homework. Make sure you're looking at that section 2 of the official FEHB plan brochure. Make sure you're considering maybe some new plans that you haven't before. A big opportunity to save some money next year, perhaps by switching to a lower cost plan. So thank you for time. Tomorrow we're doing a retiree-only focus on FEHB and big changes to Medicare Part D and Medicare Advantage. If that's something you're interested in and you were locked out of registration, send us an email to guide-to-health-plans@checkbook.org. We'll make sure that after that webinar's recording's available, we'll send you a link to it so you can watch that webinar on demand. Thanks again, and thanks, Natasha, for moderating tonight.
Yeah, no problem.
Okay. Good night, everyone.
Bye, everyone.